What's up everyone? Welcome back to the channel. Today we're talking about something incredibly important, a topic that quietly affects millions, especially our seniors and their caregivers. It's about the hidden dangers lurking in your medicine cabinet. In our quest for better health, it's common to combine prescription medications with over-the-counter supplements, but what many don't realize is that this combination can sometimes do more harm than good. You take your prescribed medications diligently, for your heart, for your blood pressure, for your diabetes. You follow your doctor's orders to the letter because you trust the science and you want to stay healthy. Then, you decide to add a natural supplement. It seems harmless, right? After all, it's natural. Maybe it's something you saw online, promoted by an influencer promising a miracle cure. Or perhaps a well-meaning friend recommended it, swearing it helped them with their energy levels or joint pain. Here's the critical piece of information that often gets missed. Natural does not automatically mean safe, especially when you're taking other medications. Unlike prescription drugs, which undergo rigorous testing for safety and interactions, the supplement industry is largely unregulated, and that seemingly innocent over-the-counter supplement could interfere with your body's ability to process a prescription drug, turning a life-saving medication into a life-threatening danger. It can either block your medication from working at all, or amplify its effects to toxic levels. This isn't scaremongering, it's a clinical reality I see in my practice. I've seen well-intentioned people unknowingly create a toxic cocktail in their own bodies. They come in with symptoms they can't explain: dizziness, unexpected bleeding, or heart palpitations, and the culprit is often a new supplement they started taking without realizing the risk. So today, we're going to arm you with knowledge. We'll break down 10 of the most common and dangerous medication and supplement combinations that you absolutely need to know about. My goal is to help you make informed, safe decisions alongside your healthcare provider. Let's get into it. First up, Warfarin, also known by the brand name Coumadin. For decades, this has been a cornerstone medication for preventing dangerous blood clots. It's prescribed to people with conditions like atrial fibrillation or after a heart valve replacement to prevent strokes, heart attacks, and clots in the legs and lungs. While it's incredibly effective, it's also a medication that requires a high degree of respect and careful management because its power to prevent clots is directly linked to its potential to cause bleeding. Think of it as a very precise balancing act, one that you and your healthcare team manage together. So, how does it work? Warfarin prevents clots by interfering with your body's use of vitamin K. Your liver needs vitamin K to produce several key proteins known as clotting factors that act like the first responders to stop bleeding. Warfarin essentially blocks the recycling of vitamin K in your liver, reducing the production of these clotting factors. This makes your blood take longer to clot, which is exactly what we want to prevent a dangerous clot from forming where it shouldn't. Because of this powerful effect, dosing is a delicate balance, managed with regular blood tests that measure your INR, or International Normalized Ratio. This number tells your doctor how quickly your blood is clotting compared to someone not on Warfarin. The goal is to keep your INR in a very specific, therapeutic range. Not too low, where you'd still be at risk for clots, and not too high, where the risk of bleeding becomes severe. This is why consistent monitoring is absolutely essential. Now let's talk about interactions. Since Warfarin works by blocking vitamin K, anything that changes the amount of vitamin K in your body can throw off that delicate INR balance. Suddenly eating large amounts of vitamin K-rich foods like spinach, kale, or broccoli can counteract Warfarin, making it less effective and increasing your clot risk. The key here isn't to avoid these healthy foods, but to be consistent with your intake so your dose can be adjusted accordingly. Even more concerning are certain supplements that have their own blood-thinning properties. When you combine them with Warfarin, you can unknowingly push your INR into a dangerously high range. Common culprits include fish oil, ginkgo biloba, high-dose garlic, and ginger. Even supplements like turmeric, vitamin E, and dong quai can amplify Warfarin's effect and significantly increase your risk of bleeding. You need to be vigilant for warning signs of excessive bleeding. This might start as easy bruising, nosebleeds that are hard to stop, or prolonged bleeding from minor cuts like when you're shaving. However, the severe risks include dangerous internal bleeding. This could manifest as black tarry stools or vomit that looks like coffee grounds, indicating bleeding in your stomach or intestines. The most life-threatening risk is a brain bleed, which can cause a sudden severe headache, confusion, or weakness. These are medical emergencies. This brings us to our most important safety rule for this section. If you take Warfarin, Do not start, stop, or change the dose of any supplement without explicit guidance from your clinician or pharmacist. What you should do instead is maintain an up-to-date list of everything you take, prescriptions, over-the-counter drugs, and all supplements, and share it at every appointment. Tell your care team about everything you take so they can safely manage your INR and keep you protected. This isn't about limiting your options or telling you that supplements are bad. It's about understanding that when you're on a powerful medication like Warfarin, your body's chemistry is finely tuned. Staying safe means making informed choices in partnership with your healthcare team. Statins like atorvastatin, simvastatin, and rosuvastatin lower cholesterol and save lives. They block a liver enzyme to reduce cholesterol production. Grapefruit juice inhibits CYP3A4, raising statin levels and side effect risk. Red yeast rice contains monocolin K, chemically lovastatin, stacking statin exposure. Call your doctor for new muscle pain, weakness, or dark urine. Could be rhabdomyolysis. Disclose supplements and grapefruit to your clinician for a safe plan. Let's start with two of the most common classes of blood pressure medications: ACE inhibitors, like lisinopril or ramipril, and ARBs, like losartan or valsartan. These are fantastic drugs. They work by relaxing your blood vessels, which lowers blood pressure and reduces the strain on your heart. For millions of people, they are a cornerstone of treatment for hypertension and heart failure, offering crucial protection for both the heart and kidneys. However, their mechanism of action comes with a hidden risk that every patient needs to understand. These medications affect a hormone system that tells your kidneys how much sodium and potassium to keep or release. By design, they cause your body to hold on to more potassium. In most cases, this change is small and harmless, but the danger arises when you unknowingly add more potassium into the mix. This often happens when people, trying to lower their sodium intake, switch to salt substitutes. Many of these products replace sodium chloride with potassium chloride, which tastes salty but dramatically increases your potassium load. Prescription potassium pills, taken for other reasons, also contribute directly to this risk. When you combine an ACE inhibitor or ARB with these extra sources of potassium, your blood levels can rise to a dangerous state called hyperkalemia. This isn't a minor side effect, it's a medical emergency. High potassium directly interferes with the heart's electrical signaling. Symptoms can be subtle at first: muscle weakness, fatigue, or a tingling sensation, but they can rapidly progress. As potassium levels spike, it can trigger life-threatening arrhythmias, which are irregular heartbeats, and in the worst-case scenario, can lead to sudden cardiac arrest. This risk is especially pronounced in older adults, as kidney function naturally tends to decline with age, making it harder for the body to clear excess potassium. This is why, if you are on one of these medications, regular blood tests to monitor your kidney function and electrolyte levels, especially potassium, are absolutely non-negotiable. Your doctor uses these results to ensure your dose is safe and effective, so what should you do? First, read labels. Check if your salt substitute contains potassium chloride. Second, and most importantly, never start taking a potassium supplement or switch to a low-sodium salt substitute without getting explicit approval from your clinician first. They can assess your personal risk and guide you to a safe alternative for managing your blood pressure and diet. SSRIs like sertraline, fluoxetine, and escitalopram boost serotonin to treat depression and anxiety. They fine-tune brain chemistry. Adding St. John's wort can stack serotonin and trigger serotonin syndrome. Watch for agitation, rapid heart rate, sweating, high fever, stiffness, confusion. Severe cases can cause seizures, unconsciousness, even death. If your SSRI isn't working, talk to your prescriber. Never add mood supplements on your own. Digoxin treats heart failure and AFib but has a very narrow safety window. Small absorption changes can cause toxicity. St. John's wort lowers levels. Fiber and antacids can block absorption. Laxative diuretic herbs lower potassium, making digoxin more toxic. Licorice can also deplete K+, increasing toxicity risk. Symptoms: nausea, vomiting, fatigue, confusion, yellow-green vision halos. Monitor drug level, electrolytes, kidneys. Diuretics like HCTZ and furosemide treat blood pressure and fluid overload. They can lower potassium and magnesium. Your doctor tracks labs. Herbal diuretics can accelerate K+ loss, causing weakness, cramps, arrhythmias. If you're on potassium-sparing therapy, adding potassium or KCl salt can push you into dangerous hyperkalemia. Electrolyte management is active. Labs, diet, hydration, and full supplement disclosure always include fluid, electrolyte affecting supplements in the conversation. Aspirin and clopidogrel prevent platelets from clumping, vital after heart attack, stroke, or stents. High-dose fish oil, ginkgo, and garlic add antiplatelet effect. You may bruise easily or bleed longer from minor wounds. Watch for black tarry stools or vomiting blood. Call for care immediately. The most feared complication is intracranial hemorrhage. If you're on antiplatelets, do not add these supplements without medical guidance. Managing diabetes aims to avoid both highs and dangerous lows, mild low sugar, shakiness, sweating, irritability, hunger. Untreated, it can progress to confusion, seizures, even loss of consciousness. Herbal agents like ginseng, berberine, chromium, and fenugreek can lower glucose further. Stacked with prescriptions and a lighter meal, they can drive glucose dangerously low. You might feel dizzy or weak unexpectedly. Check your sugar immediately. Discuss any blood sugar supplement with your doctor before starting. If approved, monitor more often. Your medication dose may need reduction. Levothyroxine treats hypothyroidism. Dosing is guided by TSH labs. Take on an empty stomach with water, 30-60 minutes before food or other meds. Calcium and iron bind levothyroxine in the gut and block absorption. You can drift hypothyroid again. Fatigue, feeling cold, constipation, weight gain, brain fog. Separate levothyroxine from iron, calcium, or aluminum by at least 4 hours. Tell your doctor when you add supplements so labs can be rechecked. Benzodiazepines like lorazepam, alprazolam, and diazepam calm via GABA. Effective but risky for seniors. They can cause drowsiness, dizziness, confusion, poor coordination, and falls. Valerian and kava also act on GABA. Melatonin promotes sleep. Combined with benzos, sedation multiplies and breathing can slow dangerously. Do not add sedative supplements to benzos without clinician approval. Ask about safer options like CBTI or treatment adjustments. We've covered a lot. The goal isn't fear, it's respect for powerful meds and supplements. Communication is key. You, your doctor, and your pharmacist are a team. Keep and bring an updated list of everything you take to every appointment. Ask, is this safe with my meds? Any interactions? What warning signs to watch for? Stay safe, stay informed, and, as always, stay healthy. Thank you for watching.